all the gang here, Kath and Michael, for inviting me back. I had just a fantastic time 2 years ago. I've been impressed by the organization here, by the spirit, and impressed by the other presenters. I've learned a heck of a lot. Today, I'm going to talk to you about cannabis and cancer. And this is a topic that actually really infuriates me, because we've known since 1974 that cannabis kills cancer cells. And there was some research that was done with mice at the University of Virginia, or the Virginia School of Medicine, I think it's called, by a researcher named Dr. Billy Martin. And it was published in a peer-reviewed medical journal. It was reported in the Washington Post, and the government of the United States and most of the other governments promptly forgot about it. And even though there's continued to be a considerable amount of research, most of the research has been on animals. And so we know that if your mouse gets breast cancer and we give them cannabis, it'll cure their breast cancer. If you're a human, not so much. And I want to go over this in a fairly organized fashion, but I'm going to tell you the bad news first is because the government, not only the government of the United States, but they have tended to control research on cannabis throughout the world, and they have discouraged research of all types. And therefore, even though we have plenty of basic science research and plenty of anecdotal evidence that cannabis has been helpful in reducing the size of tumors and extending life, we've had actually one human study that I'm aware of that was recently completed, which I'll tell you about later, and there's another human study that's going on now, and yet a third human study in which they're still trying to get the money for it. Anybody that is interested, by the way, in a medical approach, we have an organization. I've got some pamphlets here that tell you about it called the American Academy of Cannabinoid Medicine. My website, or our website, is on the first slide that you're looking at here. And also my personal website is on there, and I'll be glad to communicate with anybody that's interested. So let's move on. I don't know if you get Dr. Oz here, but he's a celebrity in the States, and he talks about that cannabis is useful, and he mentions in treating pain. Of course, it's only been used for treating pain for 4,000 years, so maybe we need more research. I don't know. And that it's useful in treating glaucoma. We know that it decreases intraocular pressure by about 25%. And Dr. Oz, smart enough to mention that it's useful in treating cancer. Okay, so as I say, we've known about this since 1974, and there are any number of cancers which have been responsive to this. Now, one of the things we need to be careful about is ascribing superhuman or super plant characteristics to cannabis. It is an amazing therapeutic agent, but it cannot do all things to all people. So if you have cancer, for instance, it may not do anything. It may not cure your cancer. It may extend your lifespan. It may make your quality of life better. So there's really not a reason not to use cannabis. We know that cannabis has been around for a long time. There are certainly some historians that think that some of the miracles that are attributed to Jesus of Nazareth were as a result of his using cannabis. Certainly, the person with seizures may have been treated with cannabis. The leper, we know that cannabis oil is useful in dealing with skin lesions. That may have been useful there. We don't have very good video from 2,000 years ago, so it's all speculation as to whether cannabis was used by Christ, but we certainly know that cannabis has been used as a medicine since, if you go along with the Chinese oral tradition and their attribution of the first pharmacopoeia to the second Emperor Shan goes back to 2637 BC, which was certainly more than the day before yesterday. But there is mention in the Bible of cannabis. The Cannabosom, a linguist in the 1930s, felt that was a reference to cannabis. And it does make some sense that that was used at that time. Now, currently, there's a lot of discussion about cannabis oil, and there's a lot of confusion. And I have to admit that I'm one of those that is confused. What is cannabis oil? Is it tincture of cannabis? Probably not. Are cannabis oil and hemp oil the same thing? Maybe, because there is this confusion. You have Rick Simpson out there who's saying, look, you take a lot of cannabis, and a lay healer that explained this to me said, well, she took a kilo of cannabis and put it in alcohol and left it there for a couple of weeks and strained off the plant material, and then allowed the alcohol to evaporate, and pretty soon she had 2 ounces of thick tarry goo. And you take 3 grams a day of this thick tarry goo, that would be about 750 milligrams of THC, and depending upon what strain you're using, it could be another couple hundred milligrams a day of CBD. Now, the sad thing is because we haven't done the double-blind studies and the fancy research, I can't tell you, oh, you need to have a 1-to-1 ratio of THC to CBD, or 2-to-1, or 3-to-1, or you need to use something that is CBD dominant or THC dominant. What I do think is that most of the research that has been done with THC dominant, but there is an enormous amount of research that also shows the role of CBD. And this makes sense because Raphael Mechoulam, who is the Israeli scientist who characterized the chemical structure of THC in 1964, in 1999 he postulated what he called the Entourage Effect, by which he meant the totality of the therapeutic effects of all of the therapeutic constituents of the plant. And plants are complicated. They're not like single molecule manufactured synthetic pharmaceuticals and that have just one molecule in them. Coffee has 880 different molecules. Tomatoes have 380. Cannabis has 512. Of those 512 molecules, 113 are cannabinoids. A cannabinoid is a 21-carbon molecule that either blocks or stimulates the CB1 or CB2 receptors. It also contains over 125 terpenes. They're the thing that give the cannabis its unique odor, and many of the terpenes have therapeutic value. Now, the reason that we don't know more, or at least I don't know more, is because you have this unreasonable position of governments around the world. Now, this particular cartoon represents General McCaffrey, who was the drug czar under Clinton. Also, according to Seymour Hersh, a reporter for the New York Times, he was a war criminal for his actions in the first Iraq War. The next person is Donna Shalala, who was the head of Health and Human Services, and also the former president of the University of Wisconsin, where I got my undergraduate degree, and I felt that she was a great embarrassment to the University of Wisconsin for taking the position that cannabis had no medical value. Obviously, she didn't know what she was talking about. And then that chubby guy at the end there is supposed to represent Clinton. And during Clinton's administration, about 750,000 people were arrested a year even though Clinton smoked marijuana and became president. George Bush smoked marijuana and became president. Barack Obama smoked marijuana and became president. So following the rationale of the prohibitionists, if you smoke marijuana, you will become president of the United States. So the man who founded the Krebs cycle had this to say about chemotherapy and radiation. These are the methods that are currently used, conventional methods that are currently used to treat cancer. Now, we look back on the way medicine was practiced 100 years ago and think, boy, were these people primitive? You can bet your boots that 100 years from now, they're going to look back at us and say, what were these people thinking about poisoning people with chemotherapy and destroying cells by using radiation? And particularly when we have this choice, this option to use that is one of the safest therapeutic agents known to man. Now, as a Western physician, I cannot tell you, I cannot tell my patients, use cannabis instead of conventional medication. Why? Because my state medical board will come after me and say, you are a quack. You are endangering your patients' lives. But what you can say is there should be no harm and the potential for a lot of benefit if you use cannabis in conjunction with these conventional treatments. So there was an excellent video, and I was sort of the technical consultant in it, entitled, "What If Cannabis Cured Cancer?" It came out about 8 years ago, so it is a little bit dated, but I would suggest that it's something that's very good to look at, to give you a baseline, to give you a foundation for understanding more about how cannabis might kill cancer cells and even possibly cure cancer. So the cannabinoids are recognized without too much dispute to have a number of benefits for people who have cancer. It can help with the depression, it can help with the anxiety, it can stimulate the appetite, it can help with sleep. But, it looks like I can't spell. That word is supposed to be anti-proliferative. And the reason it doesn't say anti-proliferative is that my writing is indecipherable. So we'll move on. But it does, as this points out, kill cancer cells, slow tumor growth, control nausea, and goes on to point out that it's not toxic. So this is not a bad medication to use if you have cancer. And even if it doesn't kill the cancer cells, which is a very good chance that it will slow the growth of your tumor or maybe even cause the tumor to get smaller, and if you're really lucky, possibly cause it to go away. Now, surprisingly, the National Cancer Institute, this is a United States organization, in 2015 says cannabis has been shown to kill cancer cells. Now, this is not breaking news. This is news that's 50 years old. It came out in 1974. Okay. Christine Sanchez is a researcher in Madrid. She works with Manuel Guzman. And this is an amazing benefit of cannabis, is that it does not have any toxic effect on normal non-tumor cells. I mean, when you get chemotherapy, the chemotherapy attacks rapidly reproducing cells, which is one of the reasons why you get nausea and vomiting, because it is interfering with the replacement of your stomach lining, which are rapidly reproducing cells. One of the reasons that you're more likely to get infectious disease is that it is inhibiting the production of white blood cells. So she's worked with Manuel Guzman. Guzman delivered a wonderful talk at Patients Out of Time in Baltimore last year, talking about the use of cannabis with conventional treatment to kill glioblastoma cells. And his presentation was very impressive as to the results. So, we know that we have plenty of not only basic science studies, but also anecdotal reports that suggest that cannabis not only can reduce the size of tumors, but can actually cause them to not be able to be found. And we'll talk about that more as we go along. But it does, cannabis does preferentially kill tumor cells over normal cells, and that's something that's really impressive. Well, how does it do this? Through at least 3 mechanisms called apoptosis, angiogenesis, and metastasis. Let's talk a little bit about each one of those. Apoptosis is cell death, programmed cell death, and the programmed cell death is for cells that are old or abnormal. And cannabis sort of hypes that mechanism up, and cancer cells, of course, are abnormal and encourages their death. In addition, it inhibits angiogenesis, which is the formation of new blood vessels. And cancer tissue, just like any other human tissue, requires nourishment and requires oxygen. And if it's not being served by new blood vessels, it's going to die. And then recently, I believe it was Dr. Sean McAllister up in San Francisco discovered that particularly he was working with breast cancer, that it interferes with a gene called the ID1 gene, which apparently is responsible for metastasis. So you have less metastasis, that is, metastasis being the movement of a cancerous cell from its place of origin to someplace else in the human body. Okay, so this sort of suggests how this might work, and you can see that the apoptosis is it lyses it, which means that the cell comes apart. And so the cannabis helps sort of stimulate this mechanism here to kill old and abnormal cells. Then we talked about the anti-angiogenic, that is, cannabis prevents the formation of new blood vessels that are needed by the tumor in order to grow and actually in order to survive. And it also inhibits metastasis. As I mentioned earlier, and Dr. McAllister worked at the California Pacific Medical Center in San Francisco there, and also Dr. Guzman, who I mentioned earlier, discussed the possibility of cannabis interfering with metastasis. So here's what the San Francisco Chronicle had to say. A growing body of early research shows a compound found in marijuana, one that does not produce the plant's psychotropic high, seems to have the ability to turn off the activity of a gene responsible for metastasis in the breast and other types of tumors. And that's what I was just talking about in terms of the ID1 gene. Now, here are some of the different kinds of cancers that basic science research with mice has shown us. Now, Dr. Donald Abrams, who's an oncologist at UC San Francisco, has said there's more than enough basic science research and anecdotal evidence to justify doing double-blind studies on humans to see whether or not cannabis is useful in treating cancer, or at least extending the lifespan of people with cancer. So you can see that there's an enormous list of potential cancers that may, in some people, respond to the use of cannabis. The glioblastoma, the brain cancer, breast cancer, lung cancer, and leukemias are the most common cancers that may respond to cannabis. However, according to an article, I think I've got a slide that'll come up on that later, from the University of Wisconsin, said that there were at least 15 different cell types involving many of these organs that are up there on this slide that responded favorably to cannabis. And they talked about the promise for cannabis as a cancer treatment. So I think this counters, hey, maybe we don't need double-blind studies to find a cure for cancer. The problem is that if you want organized medicine to prescribe this, we need to have double-blind studies. And this, of course, is where the government comes in when they say, well, there are no double-blind studies. And that's because, certainly in the States, the government has gone out of its way to block double-blind studies and make it difficult, if not impossible, to do studies with cannabis. Now, you can do studies with THC, but as I mentioned, there are 512 different chemicals, different molecules in cannabis. THC is one. So if you're using THC, you're 511 chemicals short. Okay, so this is kind of a list representing my frustration with what we're talking about. There people mean different things, but sometimes they mean the same thing by talking about these different kinds of oils. And one of the previous speakers mentioned that hemp seed oil is not the same as hemp oil. And so who knows what these are? We're tossing these labels, these titles around very loosely. And when you start looking at the use of therapeutic substances in medicine, you'd like to have some standardization. That is, you'd like to know what it is you're giving the person. It would also be helpful if the name that you're using, that everybody understands it the same way. So I cannot clarify this. I mean, we might put it to a vote of everybody in the room and see if we can agree on what we're talking about when we're talking about this concentrated cannabis that I mentioned to you before. The kilogram of cannabis into the alcohol, then letting it sit there for a couple of weeks, straining off the plant material, letting the alcohol evaporate, and ending up with 2 ounces of thick tarry goo. So the question is, what's in that 2 ounces of thick tarry goo? Well, obviously it depends on the strain of cannabis that you used to start off with, and everybody that's doing this sort of has their own protocol, and we don't see any research coming out of lay healers because peer-reviewed medical journals will reject that sort of thing. Okay, so this is sort of what I was talking about. It's way oversimplified. Pour alcohol over marijuana and mix. I would suggest you pour the alcohol over the marijuana and let it sit there for 2 or 3 weeks. And then strain off the liquid and transfer it to whatever, because you want to be damn careful. You've got alcohol now and you're heating it up, so maybe you just want to let it evaporate rather than cooking off all the alcohol. Obviously, everybody has their own recipe, but you need to be careful when following these recipes so you don't burn down the house. You might cure your cancer, but at the expense of burning down your house. So the goal is to consume a lot of cannabis oil in a short period of time. But each one of the lay healers has a different protocol. I mean, some say take it for a month, some 2 months, some 3 months. This is talking about 3 months, and it's talking about you start with a lower dose and then you slowly increase this. My guess is if you go on Google and take a look at what's the right dose for treating cancer with cannabis, that you'll find 10, 15, 20 different suggestions. One of the things that you need to be aware of course, is that just smoking cannabis, whether or not you smoke it all day long, you're not going to get enough THC and enough CBD to have any significant effect on the cell growth. Now, there was a study done in England using nabiximols or Sativex, tincture of cannabis, which has relatively low amounts of THC and CBD. And they treated people who have glioblastoma and found that the untreated people with glioblastoma had a life expectancy of about 330 days, whereas the people who were treated with cannabis had a life expectancy of 540 or 550 days. And this is using relatively low doses of cannabis and THC, more like 25 milligrams 3 or 4 times a day rather than 250 milligrams 3 times a day. In treating people, dose is related. You don't just sort of wave a magic wand containing cannabis over a person and say you're healed and have any expectation that you've done anything other than make the person feel a little bit more relieved. There's an interesting study that was done by Donald Tashkin. Dr. Tashkin is a very straight arrow kind of researcher. You can tell that by reading his reports. He is somebody whose agenda is finding the truth rather than coming to a preconceived conclusion. And many people have said or thought that smoking marijuana, smoking cannabis causes lung cancer. And as it turns out, it does not. And that's because cannabis, unlike nicotine, doesn't cause cancer. And in fact, it can treat cancer. So what Tashkin did, and he had the expectation that he would find that cannabis was associated with a higher likelihood of getting lung cancer because he had found previously that it causes bronchial irritation, which is considered to be a precancerous lesion. And also, smoked cannabis contains a higher level of some carcinogens than nicotine does. But unlike nicotine, cannabis doesn't contain nicotine. And unlike nicotine, cannabis contains cannabinoids. And cannabinoids are protective against cancer for the reasons that we talked about. So he looked at 1,100 people from the Los Angeles County Cancer Registry who had cancer of the head and neck and compared them with 1,100 people of similar age, sex, and geographic background and found that if you smoked cannabis, you had a decreased chance of getting lung cancer over somebody who smoked nothing at all. And in presenting this at the International Cannabinoid Research Society, Dr. Donald Abrams, who's an oncologist at UC San Francisco, said, well, don't your findings show that the more you smoke cannabis, the less likely you are to get lung cancer? And he said, yes. Now, as a physician, I don't really suggest that smoking is the best route of administration for the medicinal use, but it's not a bad route. And there's a lot of people who still like the respiratory route, but think that a vaporizer, because it has 70% fewer irritants, is a better way to go in terms of respiratory ingestion. Okay, so as we know, there hasn't been any cases of lung cancer that are associated with smoking cannabis, and this is another way of characterizing the results that Dr. Tashkin found in his study, which was reported on in 2004. And basically, as a result of that, the National Institute of Drug Abuse in the United States tried to marginalize him. Now, this is one of the most incredible cases. If you take a look at the top there, the white material is the cancer. And who had this cancer? A 15-month-old child who had the cancer around their brainstem And according to the surgical oncologist, it was inoperable. He told the parents, I could operate, but the two most likely results are that the child would die on the table, or if he lived, would be a vegetable. So he was given 1 gram of this concentrated cannabis a day, and he continues to take it on a preventive course since then. And he continued to see the radiologist and the oncologist. And as you can see, it goes from the tumor to much smaller at 2 months, to much smaller at 4 months, to non-observable at 8 months. And according to his physician, Dr. Jeffrey Hergenrather, the child had no side effects. The child didn't complain about being high. The child was happy as a clam, perfectly normal. And the parents, of course, were uncomfortable about telling their oncologist what they had done, so they didn't. So the oncologist attributed this to a miracle. So you got your choice. It was either the cannabis or it was a miracle, or maybe a little bit of both. And, it's because of these kinds of findings that if you take a look at your program, you'll see that there's an article in there that I wrote kind of urging Australia to take the lead in terms of doing double-blind studies on humans for seeing if cannabis actually can either prolong people's life expectancy or in some cases cure cancer. And I encourage you, by the sound of my voice, to do this. And I encourage the leaders to get behind this. And I know that you have had Dr. Dina Talley here, who's head of the Green Party, who's been a strong advocate for medicinal cannabis. And it's important to give Dr. Dina Talley all the ammo that he needs so he can convince the troglodytes that might be sharing the federal Senate with him that maybe they one day or one of their loved ones will get cancer, and it might be a good idea to have to know more about cannabis and to have that available as a conventional medication to use instead of or in addition to chemotherapy and radiation. Okay, and this is the repeat of that, and it's the CAT scans that you see in the lower left-hand corner are just remarkable. They're unbelievable, except they're true. And there's Dr. Guzman. You might want to check some of his videos. He's very good at explaining what the results of his research is. And he has been working on the use of cannabis and cannabinoids to treat cancer since somewhere around 2002, 2004. Now, some of you may be familiar with the work of Dr. Bob Melamede. He's now retired from being a professor at the University of Colorado, where he was the head of the biology department. And he has a number of presentations where he talks about the benefits of cannabis for treating skin cancer. And I'm sure that you're aware that the place in the world that has the highest incidence of skin cancer is here in Australia. One of the slides that Bob had was a picture of his girlfriend, who was from Sydney, and she had a basal cell cancer on her nose, used topical tincture of cannabis for about a month, and at the end of the month, a biopsy was done, and the cancer was gone. I think we're all familiar with Tommy Chong. Some of you may have seen the Drug Lord yesterday. Chong played this character of a doper, and he had prostate cancer, and he used Rick Simpson oil and is cancer-free. Oh, the reason I use the phrase Cheech and Chong medicine is that General McCaffrey, who earns my disdain, referred to the use of cannabis as Cheech and Chong medicine, and specifically went after the late, great Todd McArea, who recommended cannabis for many, many things and paved the way for many of us physicians who come later. And I think it's kind of ironic that Tommy Chong had his serious medical condition cured by cancer after being ridiculed by General McCaffrey. General McCaffrey is notorious for getting all his facts wrong, by the way, and being an inveterate prohibitionist drug warrior, and pretty much anything that comes out of McCaffrey's mouth is not worthy of being believed. Okay, so I mentioned earlier what a cannabinoid was. This is kind of an old slide because it says there are 66 compounds in the cannabis plant. That's not correct. There are 512. The 66 really referred to the cannabinoids, and now it turns out over the last several years more and more have been discovered, and so there are 113. And even though we talk a lot about THC and CBD, we know that CBN, CBG, CBC all have therapeutic benefits, and there's another 9 or 10 cannabinoids that we know have therapeutic benefits, and we know that the terpenes have therapeutic benefits. And the combination of the ingredients effect is greater than any one constituent by itself. So if some drug company comes along and tells you that THC is better than cannabis, they're wrong. It's true. I've written a lot of prescriptions for THC, and it works. What I tell my patients is that dronabinol, which is synthetic THC, is more expensive than cannabis, doesn't work as well as cannabis, and has more side effects. But I do prescribe it because it does work, and some people prefer something that's been approved by the Food and Drug Administration or something that they can go into their conventional pharmacy. And sometimes I prefer it because I know exactly how much THC the person is getting. And also, there are a few more insurance companies that are covering it. But all in all, from a therapeutic point of view, cannabis is preferred to THC, but don't throw the THC out because it does have some usefulness. Okay, so this is a little more up-to-date slide regarding the various cannabinoids. Recognize, okay, you got 21 carbons, and so if you add an OH to one carbon, you've now got a new compound. If you move that OH to another carbon rather than that one, that's a different compound. So you can see that there's almost a limitless number of cannabinoids, and that's why the number keeps increasing from 66 to 113, and it'll be a higher number next year, I'm sure. Now, one of the things that you need to be aware of is that when you have the plant, the cannabinoids are in the acid form. And so the acid moiety gives a different shape configuration to the molecule and a different electrical charge, and therefore it fits into the receptor differently. And with the raw plant, if you juice the raw plant, you can drink as much till you're sick of it, and it won't get you high. Now, as Donald Abrams, the oncologist at UCSF, says, in his patient population, a little euphoria isn't a bad thing. So I'm not putting down euphoria here, but what I'm saying is that you can have a higher dose of cannabinoids with impunity and not have to worry about the euphoria that's almost certain to come along if you ingest, say, more than 20 milligrams of THC or more than 30 milligrams of THC. And Dr. Bill Courtney, is really the most knowledgeable person about juicing. He is currently in Dominica. He got hassled by the Medical Board of California and thought that practicing out of the United States was better for his own health. But many of these constituents of the plant do have anti-cancer properties. And we're beginning to see some research that's being done on this stuff. We're beginning to see GW Pharmaceuticals in the UK do some research on some of these other ones. But right now, GW has 2 products, and so they're trying to maximize their profit on them, and that's why they used the nabiximols or Sativex to see whether or not that had any effect, whereas using a more concentrated product likely would have had a more impressive effect than what they used, the dose that they used. So these cannabinoids are very similar in structure. And so you can see that several of the cannabinoids have similar therapeutic effects. You can also see why CBD has gotten the enthusiasm that it has, but THC certainly has a lot of therapeutic effects. We know that from 4,000 years of medical use, medical history, and we also know that from the fact that ever since the 60s, cannabis has been grown for its recreational benefit, therefore has had very high THC, very low CBD. Nevertheless, we have had an untold number of basic science studies and anecdotal reports about the benefits of cannabis. And I'm, here to sort of apologize, I guess, for the medical world that we can't tell you what the right dose is. We can't tell you what the right ratio is of THC to CBD. Most of us can't tell you what role CBN plays or CBG plays. I mean, if there's anybody out there that's looking for a career doing research in the science of cannabis cannabinoids in the endocannabinoid system and on its therapeutic benefits, you are going to have a lifetime of employment and a lot of exciting intellectual stimulation. So this is another example of the different cannabinoids, and this is just a handful, right? This isn't anywhere close to 113. It does indicate again that the CBD certainly has a lot of therapeutic aspects to it, but the Meshulam is right about the entourage effect, that when you take these things working together rather than working in isolation, you're much more likely to have the desired therapeutic effect than just taking THC alone or CBD alone, or even just combining THC and CBD, because if you just use those two, you are short by 510 different chemicals, and you're selling the plant short. So there's an awful lot we don't know, right? We don't know the appropriate dose. I mean, I certainly have some educated guesses. They may or may not be any better than your educated guess. We don't know the length of time between doses. Partly that's because everybody's different, and so an oral dose is going to last about 3 to 6 hours. Well, that's a pretty big difference. We don't really know what strain because we haven't been testing them until recently. We don't know the THC-CBD ratio. We don't know the role of other cannabinoids and terpenes. So why don't we know that? It's because research has been blocked. And even when the United States federal government, in the rare occasion, approves a study, as they did with Dr. Susan Sisley, I mentioned her research earlier when I talked about PTSD. She was at the University of Arizona and jumped through all the hoops to do a study on the use of cannabis in veterans. And what happened then was that one of the state senators in Arizona threatened the University of Arizona that if they continued to employ Dr. Sisley, and I forget exactly what their threat was, either they wouldn't pay Dr. Sisley or they would decrease the amount of money they were giving the University of Arizona. In other words, at any rate, that threat was sufficient to cause Dr. Sisley to lose her job. Fortunately, there were some cannabis-friendly folks in Colorado who are funding her research, which has been approved by the U.S. government, but it's a rarity. I mean, there's an organization that throws conferences every year called Patients Out of Time, and every couple of years they have a panel of researchers, of scientists, of clinicians who get up and give stories about the difficulty and the impossibility they've had of getting research approved by the United States government. So again, we don't know what ratio of cannabinoids to use, we don't know the dose, and we don't know how long in between. Now, so Rick Simpson is a layperson, and he certainly has a lot of experience, but he hasn't done any double-blind studies. Now, on the other hand, if you have cancer, you may want to take cannabis, but it would be nice if you knew how much THC to take, how much CBD to take, what strain you should use. So this is his formula for making Rick Simpson oil. And there are innumerable recipes for making this, and of course, there are innumerable names for it, as we've touched on before. So there are three double-blind studies, one that's ongoing, one that was just completed, and one that the fundraising is still going on. Now, in the UK, they did find that the life expectancy from glioblastoma went from 330 days to 550 days. Now, I'm not sure about the Israeli study in terms of what dose they're using, but if they're using a higher dose, it'll be interesting to see whether they come out with different results. Now, in regards to breast cancer, I'm reminded of a physician in Santa Barbara who was a general practitioner and did a lot of medical cannabis recommendations, who got cancer of the breast. And she was admitted to our local hospital with metastasis to her brain, metastasis to her liver, and at that point she got an intervention from one of the lay healer people and gave her, this 3 grams of concentrated cannabis a day. It killed the metastasis in her brain, it killed the metastasis in her liver, and they couldn't find the breast cancer anymore. She, after taking the 3 grams a day, she continued to take 1 gram a day for 3 years. However, at that point, her husband said he didn't like the taste of marijuana in her mouth, so she stopped taking the cannabis, and 6 months later, she was dead. So you have to take a maintenance dose after you've cured the cannabis. I mean, your propensity to have cancer in the organs and the cells in the organs that you had cancer in the first place doesn't go away just because you use cannabis. So we need more research, and I made this for a U.S. audience, but you have a federal government, you have a state government, you have medical schools, you have a pharmaceutical industry. You need to stand up, and no better example of that than Nimbin, to the neo-prohibitionists who will say anything and do anything to discredit cannabis. And if you take a look at the movie that Eric Ries of Drug Laws put out, you'll see that the drug laws have been used as a way to other people, as a way to discriminate people, as a way to demonize and further marginalize already discriminated against groups. And this doesn't have a damn thing to do as to whether or not cannabis is an effective medicine. We need to educate the media. They need to talk about cannabis. The term marijuana is specifically used to demonize cannabis and by extension, to demonize the people who are using cannabis. Recognize that in 1937 in the United States, when the Marijuana Tax Act was being debated in Congress, the American Medical Association testified against the Marijuana Tax Act and said the AMA knows of no dangers from the medical use of cannabis. So we need to educate the government, and we need to educate the medical establishment, and the folks here at Nimbin are well aware of that. And that's why they've invited physicians like myself and other physicians, and it's important for you to go out and educate the medical establishment. The more that your physicians, your individual physicians, hear from you that you are using cannabis and getting a medical benefit from it, the more open they're going to be to thinking about it, to reading about it, to learning about it. And in the U.S., only 13% of medical schools even talk about the endocannabinoid system. Okay, so remember I mentioned the AACM, that's the American Academy of Cannabinoid Medicine, and that's our website down there, or if you want to contact me, that's my website there. And there I am in Jerusalem with Raphael Meshulam, and very bright, very considerate, very important man in the history of cannabinoid medicine. Before I take questions, I want to encourage you to at least come back and take a look at this book. It has a lot of pictures in it, the captions in it. It's a great book for skimming. It's a wonderful book to use as a reference text. And it contains some of the information that I have here in a little bit greater detail. But basically what I'm talking about in the book is the history of the use of drug laws to marginalize, discriminate against people. But the last half of the book really tells the modern history of medicinal cannabis. So with that, I'm going to come to the end of my formal presentation and open it up for questions and see if I can see any hands out there. Okay, any questions?
I've got the mic.
When you were talking about having the raw plant treatment, do you think that the effect of the cannabinoids and all the molecules in the cannabis are just as great, or does it for treating cancer, or does it more need to be an activated molecule?
Can you back up and repeat that again? I'm deaf as a post, so...
When comparing raw cannabis as a medicine with the level of cannabinoids you can eat to treat cancer, or would you do that, or would it be preferable to have an heat-activated cannabinoid, a psychoactive cannabinoid?
That's a very good question that, in all honesty, I can't answer. I think the main benefit of juicing is that you can take an almost unlimited dose without getting high. But since we don't have any research and all we have are anecdotal reports, I don't think that anybody can definitively say whether or not an alcohol extract or a CO2 extract or using olive oil to extract the constituents or the raw plant is better. I mean, that's one of the things that frustrates me. About 2.5 years ago, the daughter of the woman I took to the prom, which was more than a few years ago, called me, and we've continued to be friends. And her adult daughter, a woman in her 40s, who was a school teacher back in Wisconsin, said that her father had a glioblastoma, and was there anything that I could do to help? And I was really hopeful that there was something I could do to help. But because they lived in Wisconsin, which is not a medical marijuana state, I suggested that they contact some people in Minnesota, which only had limited access for a few limited conditions, and they really didn't have a lot of Rick Simpson oil there, and the man unfortunately passed away without being treated with Rick Simpson oil. So we really need to have the research that I talked about before to be able to answer the question that you're raising. And I mean, we should all be raising hell because there's a lot of questions that need to be answered, that it's not good enough for somebody to step up here and say, oh, well, I've treated 10 patients or 20 patients and used this, that, or the other thing, and I don't really know what it was. We didn't really get it tested, but I know that the cancer went away, which is all well and good, but how does that apply to the next man or woman that has that particular condition? How much should we use? When should we use it? So I wish I could answer your question, but I can't. Any other questions, which I also probably
Yes,
can't answer,
here.
but
Here. Me? I'm over here.
Yeah.
To your left. Over here.
over where here?
Hello.
Okay.
I'm here. Why is Israel so advanced in its cannabis research?
Well, being Jewish, my response is because they're Jews. What do you mean? But no, it's because I think it's because of Dr. Meshulam. If you were here yesterday and saw Eric Rees's movie, he had the Meshulam story. Back in the 60s, Meshulam was sort of in between chairman of his department, and they went to the chief financial officer, he and another scientist, and said, we'd like to do some research on characterizing the principal constituent of cannabis. And they had reason, look, we know the chemical structure of morphine and opium and cocaine, but we don't know the chemical structure of THC. And so they said, okay, well, you're not doing anything else. Sure, go ahead, do that. And they said, well, no, we're going to need at least a couple of pounds of hash. So the chief financial officer of their department said, well, you know, I know the deputy chief of police of Jerusalem. We were in the army together, and I'll call him up. So he calls up the chief, the deputy chief, and says, look, I have a researcher here. He can use some cannabis. And deputy chief says, well, is he reliable? He said, sure, he's reliable. So Meshulam gets on a bus, goes down to the police station, and the deputy chief gives him 5 kilos of cannabis. Meshulam puts it in a shopping bag, gets back on the bus, and goes back to Hebrew University, where he then characterizes the structure of THC. Now, he has been surrounded by a group of brilliant researchers, and people basically come to Israel or nowadays use the internet to interact with Dr. Meshulam and the scientists that he has got gathered around him, because they have the most experience. And also there's a community of researchers, much like Nimbin, in which there's a lot of cooperation. And so the Israelis, as well as labs in Italy and Spain and some in the US, often work collaboratively on the same projects. But I think that you have a greater willingness on the part of the government in Israel to allow this kind of research, even though there still is a certain amount of resistance even in Israel, but they, I think, are more willing to be intellectually honest. But I also think that it's the personality of Raphael Meshulam, who is an incredibly decent and brilliant person who is certainly revered in the medical cannabis community. And I think that he has figured out how to work with the authorities without ruffling their feathers. And I also think that Israel appreciates the international respect that Meshulam has gotten for the work that he's done in this field. That's just my guess, but I think it's more this human side than any particular sort of governmental thing or any clever strategy that has been done to get medical cannabis accepted in Israel. Now, is there another question?
Yeah, I've got one.
Okay.
Just pertaining to suppositories as a delivery method for cannabinoids, particularly for cancer. Just wondering if you've got any experience either way on that.
Okay, so you've got another speaker who is an expert on suppositories. So I'll give you a short answer, which is easy because that's all I know. But the cannabinoids are be able to be absorbed through mucous membranes. In other words, The Sativex, the nabiximols, is a sublingual spray, and it's absorbed through the mucous membranes in the mouth. By the same token, if you put a suppository rectally, it'll be absorbed by the mucous membranes there. Now, I was talking to a pharmacist who's also a grower who was saying that the likelihood of euphoria is much less than by using a suppository than by having the oral administration. That's about it as far as I know. I mean, I have a funny story to tell you regarding suppositories. It's not going to make you any more knowledgeable, but maybe it'll give you a laugh. Anyway, the gentleman who is in charge, there's only one place in the United States where you can legally grow cannabis. All of the places where it's being grown other than that are technically illegal. They're breaking federal law. The federal government has chosen not to push it. It'll be interesting if and when they do. But at any rate, the University of Mississippi has, I think, a half an acre of cannabis. And I always was a little bit suspicious of Mohammed Al-Suli, the PhD that has the contract with the government to grow marijuana there and to do research with it, in part because he was developing a suppository. And I figured that that was just a graphic way of telling us what to do with our medicine, and that maybe he was just a stooge of the DEA. So anyway, I was at a conference in Chicago about 4 years ago, and Ed Rosenthal, he used to have a column in High Times called Ask Ed. He writes books about growing cannabis. And he calls me over and he says, well, you know, Dr. Bearman, I want you to meet Mohammed Al-Suli. He's an old friend of mine, and he was very complimentary. He said that you two guys are the most knowledgeable guys I know about this. Well, I thought maybe this guy isn't a stooge for the DEA. If, you know, somebody who's out there as Ed Rosenthal thinks that he knows his stuff and that he's, you know, straight arrow. So anyway, after a few minutes, I sort of decided that I'd tell Al-Suli why I, you know, maybe had some concerns about him. And I said, you know, I was concerned because you were making the suppository. And he said, well, let me tell you a joke that David Letterman, you may know who Letterman, he's a comedian in the U.S., and he had a late night show. And one of Letterman's gestures was to pretend to be smoking a cigarette or a joint. So I'm just going to... And so he says, he said, this scientist is outside smoking, and he says he sees the police come. And that's what he does. And he says that's how he discovered the rectal route of administration. Obviously, I've got to keep my day job. I'm not as good at telling this as Letterman. But the point is, I think, that the more that we treat cannabis as we would any other medication, the better off we are. I mean, we have a lot of medications that are effective rectally, and why wouldn't cannabis be effective? And it is, of course. But I really don't know that much about it. I think that it's another thing that's really just coming into its own is the suppository route of administration. And I'm sure that if you ask that same question here next year or the year after next, that you'll get a much more nuanced answer than I can give you today. Are there any more questions out there? Okay, well, I hear resounding silence.
There's one here. There's one here.
You got one more?
Are you aware of Hippocrates mentioning cannabinoid therapies back in his day?
Say again?
Hippocrates, does he mention cannabinoid therapies in his teachings?
You know, I don't recall. I haven't included any quotes from Hippocrates. I do know that, you know, we have it in the oldest pharmacopoeia from 2637 BC. We have it in Ayurvedic medicine from India in 1700 BC. We have it in the Materia Medica that was put together by Discordis, who was the physician to Nero, and it's in the Ebers Papyrus, but I don't know about Hippocrates. And if he did, tell me about it afterwards, and I'll add it to my storehouse of stories. All right, one more? Any more? Well, look, I want to tell you what a pleasure it is to be here. I want to thank, again, the folks from Nimbin. I want to tell them how impressed I am with the inclusiveness of their presentations and their activities that they have going on here. And I want to let you know that I'm going to be in the back of the room, available to chat and sign the books if you buy it. I don't think you'll be disappointed. It's a great history. It's got a lot of good medical information, and I want you to join me in enjoying the rest of Mardi Gras. Thank you for coming. Have a good life. Bye.
Thank you.